Yo, DJL7 here, and today we're outside of Elmhurst Hospital. That's right. And Elmhurst Hospital, as well as a lot of hospitals, have a lot of problems. Now, the thing is that if you look at the number one expenditure for New York State, number two is education, but number one is healthcare. And a lot of people, just so you know, I actually was, I've taken my, it was most of my girlfriends that I took to the emergency room. I have a couple bad stories about it. I have another video called, what Medicare for All won't solve, or something like that, right? You guys can look that up, but the thing is that I've taken my friends to the emergency room. Also, being homeless, that's also a place where you can stay overnight, but I really don't recommend it. There's all kind of sick people there. There's no electrical outlets. They're hip to the game. If you really need the air conditioning, something, but you're gonna get sick being there. It's just not a good place to hang out. But the healthcare system, all right, people say they want free healthcare, and I understand that. And there's some other countries where this is kind of working, but here in the United States, the healthcare system has been so corrupted that you really can't trust it, and you can't take a whole bunch of broken parts and then make something like really coherent out of it. There's so many bad actors within the game, and there's so many, problematic, things that have been allowed to persist so long that even if you try to reformulate it, these bad actors are going to actually just screw things up. And I have a lot of medical experience. I was in medical school. I worked as a medical scribe for a Harvard-trained pulmonologist, a neurologist. I've worked for several emergency rooms. And, while the doctors mean well, let's think about this, right? Okay, when's the last time you've been to a doctor? Was it like this? The nurse or someone else went and took your vitals. Maybe the doctor did it very kind of cursory. Then the doctor ran into the room and said, just racing as fast as they could to say what you have in his plan or her plan for your medical care. Then they literally ran out of the room, and then everything else was being taken care of. The doctors have not really been able to successfully push back against the bureaucrats that have compromised the quality of your care. And they did this because they want the money. They get certain bonus incentives, they get certain penalties for not seeing a certain number of patients an hour. So they're gonna do what's in their best interest. You could even see there's studies for the amount of C-sections goes up, right? These are pregnant women we're talking about. When it's time for the shift to end, or when, things like this, right? Like what happens, the healthcare actually serves a convenience factor for the medical care professionals. And that becomes prioritized over the well-being of the patients. This happens in a lot of, also DSA loves to talk about the workers, but sometimes I've been part of different jobs and stuff where the workers have actually abused the public trust in order to ensure themselves a payday. This is definitely something that happens. If you work as a contractor, you've probably seen this as well. It's quite rampant, especially in anything related to the city. So, another thing is that I've worked with that's what makes me so dangerous, right? Because a lot of the people who are, your typical, I guess you could say, Republican debaters, right, who are pushed by TPUSA, they've never really dug into the depths of this kinds of issues. So they just repeat what they've heard on some other TV show without any true understanding of the real problems or what's really convincing to the other side. And this is actually encouraged by both sides, the left and the right, in order to keep the activism on a certain level, to keep it safe, instead of having real progression, real talk about these issues. That's a fact. So I also did work with the. I was working in Medicare for All for a while, in that movement. And come to find, right? How much have you done for this movement, right? And you might like, oh, you're not for Medicare for All. Fuck this guy. Blah blah blah. You know what I mean? Okay. How much have you done for it, right? I was actually one of the organizers for the Medicare for All March, and I found that all the activism on a nationwide basis is dominated by the doctors who's got the money to give these organizations and the drug companies, the ones that you're supposed to be fighting against. It's the same thing as the breast cancer fight, right? Like the chemical companies are really kind of steering the whole activism, making sure that all we talk about is, you know, detection of breast cancer instead of what's the actual causes of it. The people that are actually poor, the people that are actually, you know, been negatively impacted by the health systems, you know, such as things like the opioid crisis, things like that, they've been silenced and pushed out the way. So, you know, I think I said it before, the activism is really, as you see it on TV, is mostly a wolf or a wolf in sheep's clothing. And the regular people's issues, regular people don't invest in activists. So instead they invest in celebrities and they invest in, you know, BS, right? They invest in low effort solutions. And this is really, you could blame the celebrities, you could blame, right, the Jeff Epsteins of the world. They're not the problem. The problem is society, which doesn't have the energy to dig deeper into these issues, that doesn't really care about these things. It's really sad. So, just so you know, within the, also the split of the, there's a different section besides just healthcare. There's a separate section for like mental health type issues, right? People that are actually like, you know, being crazy and stuff like that. So that's a separate line, and that has its own dedicated funding. So healthcare is the real cost of healthcare is actually higher than, you know, the already the highest, but they're masking some of the other things through different rates. Another thing that I can tell you about a lot of these doctors and medical places is, right, people say Medicare for all, but if you look, NYU's actually acquired a lot of the hospitals around, you know what I mean? And the owner of NYU, or right, very high up, is actually this guy named Langone, or with the guy Kenneth Lay or something. He's it might not be that. It's the guy who's associated with Home Depot. And the kind of care that, you know, I've been at meetings with other health professionals, and they'll complain, oh, you know what, like when the certain elites come by, the level of health care that they get and the way they get prioritized and shuffled in front of other patients is, we don't really like this. So they're out there complaining about it, but they're not complaining to the point where they're going to cause a real problem, because then they lose their jobs. And I understand this, you know, but what happens is a steady degradation of, you know, the norms and the and what's going on. It's very disturbing. So the healthcare industry, I just really can't be trusted. You can see Dr. Fauci. I know a lot of people want to defend him, but he literally said no masks. Don't wear a mask. Then he said wear a mask. There's this violation of trust is not okay. So this is probably really, really bad, because, I mean, for my election prospects, confronting these issues, because these people have lots of money for lobbyists. And if you look at the New York State Nurses Association, they are very powerful. SEIU, very powerful on Capitol Hill. While I do support some funding for people who are disabled, things like that, to assure that they have accessibility, this was not something that they chose. All right. The accessibility for poor people of these services, such as myself, right? Like, it's just not really there. So there's a lot more I could say about it, but I don't want to get anybody in trouble out here. You know, I don't really have the power to really to fix the problem if I create it, right? And I have no faith that people out there is really going to look into this and really assist on this issue. So I gotta, poor people don't get pure food, you know? We gotta figure out how to make do with what we got. So it is what it is. Thanks for checking out, folks. That's this today's little daily vlog on the healthcare in New York State.